This week, we'll dive into one of the most creative and strategic parts of the policy analysis process, which is identifying policy options. So far in the course, we focus on defining problems, setting up criteria, and gathering evidence. And now we'll turn to the next major step and figure out what can actually be done about the issue. This is where we will start to think like policy designers by generating and refining possible courses of action that could realistically address the problem. We'll look at how analysts develop alternatives, the tools available to policymakers, and the trade-offs they must consider when moving from ideas to implementable options. By the end of this week's session, you should be able to do three key things. First, understand the concept of policy alternatives, what they are, and why they're central to the policy analysis process. In most policy frameworks, this is the stage where creativity meets evidence. And second, become familiar with the key steps and procedures that analysts use when researching and constructing policy alternatives. We'll look at systematic approaches like brainstorming typologies of instruments and the policy toolbox concept to ensure alternatives are comprehensive and comparable. Third, we'll explore some common challenges and pitfalls. For example, analysts often generate options that are either too narrow or too broad, but I'm getting ahead of myself, so let's dive in. Let's begin by defining what we mean by policy alternatives. Bardak and Patashnik describe policy alternatives as alternative strategies of intervention to solve or mitigate the problem. And this is the essence of our analysis, really, translating a diagnosed problem into a menu of plausible solutions. Kraft and Furlong remind us that a policy alternative is essentially a tool at the disposal of the policymaker. In other words, alternatives are not just abstract ideas, they're instruments that we design for courses of action that governments or other actors can use to achieve desired outcomes. Finally, Patton, Sawicki, and Clark emphasize that alternatives are sought because someone, a client, an agency, or a community group, has recognized a problem that requires change. It's the analyst's role to identify feasible actions that can ameliorate that problem. So as you can see, this step connects the analytical with the political. We're not just thinking about what might work in theory, we're thinking about what could be implemented in a real-world context with real stakeholders, constraints, and trade-offs. To illustrate what we mean by identifying policy alternatives, let's take a concrete example in the problem of high HIV incidence. In policy analysis, once we've defined the problem, our next task is to explore the range of interventions that could address it. Notice here that we can generate alternatives across different domains. For example, in prevention, these are classic front-end strategies such as expanding PrEP access, distributing condoms, and supporting needle exchange programs. These aim to reduce exposure and risk behaviors. Under treatment as prevention, which is grounded in strong evidence, this focuses on early diagnosis, linkage to care, and universal access to antiretroviral therapy. Remember that people who are virally suppressed are unable to transmit the HIV virus. Next, structural barriers such as stigma and criminalization often undermine adherence and prevention. And finally, health system strategies involve system-level interventions such as integrating HIV and primary care services or increasing budget allocations for HIV services and research. Each of these clusters represents a set of policy alternatives or a different lever that policymakers might pull. In practice, a comprehensive policy mix often draws from several of these domains simultaneously. A common question is, at what point in the policy analysis process do we identify alternatives? And of course, you can see here among the different frameworks we've studied, that varies. However, you can see that these all are next to either before or after evaluating the criteria, which we covered previously. So now that we know where this step fits in the policy process, the question becomes, how do we actually search for and identify these alternatives? At this stage, it's both analytical and creative. It involves reviewing existing policies, scanning the evidence, consulting experts and stakeholders, and brainstorming new approaches. Bardak reminds us that this part of the process benefits from thinking broadly, but screening rigorously. Analysts must be open to multiple approaches, not just what's politically popular or currently funded, but also must ensure that each alternative is feasible and clearly linked to the problem at hand. Weimer and Vining, as cited by Patton, Sawicki, and Clark, provide a useful typology for sources of policy options, so let's go through each briefly. Under existing policy proposals, we have ideas already circulating in the policy environment, perhaps introduced in past legislation, in pilot programs, or advocacy platforms. Analysts can refine or adapt these rather than starting from scratch. Under generic solutions, we have broad categories of interventions that can be applied across multiple policy issues, for example, regulation, taxation, subsidies, or public information campaigns. These provide a starting point for structuring alternatives, and we move now to modified generic solutions, the third source. Sometimes generic tools need adaptation to a specific context. For instance, a tax incentive might be tailored to target HIV medication manufacturing or distribution in low-income areas. Then we have custom-made solutions. These are innovations or novel strategies designed to uniquely prevent or solve the problem at hand. Often, these are developed through stakeholder consultation or interdisciplinary collaboration. Now that we've talked about where ideas for policy alternatives might come from, let's look at what governments can actually do, which we covered previously. Here you can see a wide array of instruments or tools of government action that policymakers can draw upon to address public problems. Each corresponds to a different type of intervention that you're welcome to read yourselves. But we'll move now to how some of these instruments might play out in practice and use examples from New York State's HIV policy environment. So, under regulation, we have, for instance, the New York State Public Health Law, Article 27F, which governs HIV testing and confidentiality, requiring informed consent and regulating disclosure, as well as penalizing violations. This is a clear example of governments using regulation to protect public health and privacy. Under subsidies and grants, we might consider the New York State PrEP AP program, which helps eligible residents access free PrEP services and related screenings. It's a subsidy mechanism aimed at prevention and equity. Under the structure of private rights, we have the New York State Bill signed into law in 2023 that establishes a long-term care Bill of Rights and addresses structural discrimination in care facilities. And this shows how policy can reshape private rights to promote inclusion and justice. And finally, on this screen, we have the New York State Finance Law, which intervenes under the auspices of the Department of Health AIDS Institute and manages training and education contracts for HIV and other STIs. So how do we get from a policy issue to a list of policy alternatives? The transition in the middle is often the hardest part for analysts at first because it requires balancing creativity, evidence, and practicality. So think of this as a bridge. On one side, we have our clearly defined problem, and on the other, we want a well-structured menu of feasible evidence-informed options that decision makers can consider. So the methods we'll explore next come primarily from Patton-Sawicki and Clark, who outline systematic approaches analysts can use to generate, test, and refine these alternatives. First, here are some of the key methods analysts use to identify policy options, and we'll now move into these more deeply. Beginning with research analysis, analysts might gather data through surveys of end users or experts to understand feasibility and acceptability, as well as comparative policy analysis, examining how others in other jurisdictions have tackled the same problem. The no action or status quo alternative is often overlooked, but it's a critical benchmark in any policy analysis. As Patton-Sawicki and Clark describe, this represents the state that would evolve in the absence of the plan or program. So including this option, which should always be the case, allows analysts and decision makers to compare new interventions to what would have happened if nothing changes. Quick surveys are rapid, pragmatic tools for gathering insights when time or resources are limited. Rather than conducting full-scale research, analysts conduct information from easily accessible sources such as policy networks, professional listservs, meeting minutes, or newspaper articles and letters to editors. The goal here isn't to achieve statistical rigor, but rather to scan the policy environment and identify emerging ideas, attitudes, or potential barriers. For example, a quick survey might reveal that multiple community organizations are already piloting harm reduction interventions, and this gives analysts real-world examples to consider as alternatives. The literature review is also another cornerstone method for identifying alternatives, especially in public health policy. Here, analysts examine published material, such as books, journal articles, reports, and gray literature, to identify strategies that have been proposed or tested elsewhere. Think of this as an environmental scan of existing evidence that has been produced in a more rigorous environment. Journals like Health Policy, The Lancet, and Health Affairs regularly publish studies and evaluations, as well as frameworks that can serve as models for policy alternatives. In practice, this method helps analysts understand not just what options exist, but also how they've performed under different contexts, politically, economically, and socially. For example, reviewing literature on tobacco control policies might inform approaches for regulating emerging health risks like vaping or cannabis use. The strength of this method lies in its breadth and credibility. It grounds your policy options in prior evidence while also helping you identify gaps or opportunities for innovation. Next, real-world situations are about grounding our alternatives in practical experience, or what's actually worked elsewhere. So as Patton, Wiki, and Clark note, the goal here is to generate a list of possible options that experience has shown can be implemented. And instead of reinventing the wheel, we learn from real cases, especially those implemented in contexts that are similar to ours. So, for example, the World Health Organization has developed a comprehensive package of interventions for HIV among people who inject drugs. It includes needle exchange, opioid substitution therapy, testing, and targeted communication. This kind of reference provides a ready-made menu of proven evidence-based policy alternatives. Analysts can then adapt these to their own policy context and perhaps integrate them with local strategies and funding mechanisms. Real-world examples also help anchor your analysis in political and administrative feasibility, showing not only what works but also what can be done under real-world constraints. The next method, which is passive collection and classification, is a bit more opportunistic. So instead of actively designing new ideas, analysts collect existing proposals that have already emerged in the policy space. And these might come from clients or policymakers commissioning the analysis, advocacy groups or coalitions, interest groups and professional organizations, or directly from communities and affected populations. Kraft and Furlong point out that these proposals often reflect competing priorities or value systems. Your job as an analyst is to catalog and classify them, not yet to judge them. So here we want all viable perspectives represented in a policy option list. For example, if you were developing HIV policy in New York, you might collect proposals from the AIDS Institute, advocacy coalitions, and community-led organizations, each offering different strategies and perspectives. Passive collection is efficient because it builds on work that's already been done or is ongoing, and also ensures inclusivity, making sure no key voices are left out of early stage analyses. Using different typologies helps us organize policy options based on who is affected and what type of intervention is being proposed. Patton, Wiki, and Clark emphasize that typologies make our thinking systematic. These ensure that we consider all relevant groups and intervention categories. For instance, when analyzing HIV prevention policy, we can't ignore the HIV key populations. These are men who have sex with men, sex workers, transgender people, people who inject drugs, and people in prisons and closed settings. So when developing typologies about these groups, analysts can identify coverage gaps. For example, noticing that a proposed policy focuses heavily on clinical interventions, but may ignore structural or community level needs. At this step, we can also reveal potential equity issues. For example, are certain populations consistently excluded from the proposed alternatives? You might also reflect here that if we develop the typology, for example, for obesity prevention or climate-related health, what categories or groups might you include different from these? And we also have analogies that are creative. It's an approach that involves borrowing insights or solutions from other policy sectors. Sometimes these can be very different sectors, and we adapt these to the problem at hand. So as Patton, Wiki, and Clark explain, the analogy may come from an area quite different from that of the problem. For example, think about how public health campaigns have drawn on strategies from marketing and behavioral economics. For example, these include nudging, social norm messaging, or loyalty type incentives, and how the concept of harm reduction in drug policy has inspired approaches in sexual health, alcohol regulation, and even food policy. The key is to imagine yourself as the client or end user of the policy. What has worked in other domains might work elsewhere and could solve similar challenges that we face. In this method, we encourage innovation, cross-sector learning, and often this leads to hybrid strategies that can blend tools from multiple policy arenas. Next, we have group idea generation and synthesis, which can be described as a creative conference for producing a checklist of ideas that lead to a problem solution. Typically, this unfolds in two stages. Under idea generation, we encourage participants, such as analysts, stakeholders, and community representatives, to brainstorm as many potential approaches as possible while suspending their judgment. And then we have the second phase of idea evaluation and combination, which occurs sequentially after generating ideas, and here participants can group, refine, and merge them into coherent policy alternatives. Think of this as moving from raw creativity to structured synthesis, and you can use simple tools like post-it notes, whiteboards, and online collaboration tools. In HIV, for example, one group might focus on health system integration, another on stigma reduction, and another on digital health tools. And then all groups would combine their outputs to yield a hybrid policy alternative that leverages multiple domains. This method not only broadens participation, but also promotes ownership and innovation among stakeholders, which is a key factor in policy success. The ideal alternatives method allows us to imagine what the best possible solution would look like, even if it is unrealistic. So Patton, Sawicki, and Clark write that analysts should conceptualize what the ideal alternative would be, barring resource limitations, political constraints, etc., even if that ideal is beyond reach. It's an aspirational approach, of course, but it helps analysts and policymakers clarify ultimate goals or principles that should guide policy design. For example, an ideal alternative for ending HIV transmission might envision universal access to PrEP and antiretroviral therapy, the complete elimination of stigma, and integrated digital tracking for care continuity that permits zero new infections globally. While we may not achieve this exact state in the time being, articulating it allows us to identify incremental steps toward that vision. So far we've discussed how to identify and generate alternatives, and now let's move to constructing them, which is to take our long list of potential ideas and shape them into coherent, viable policy options ready for evaluation. This step involves integrating multiple methods, considering feasibility, and often modifying ideas so that they align with real-world constraints and stakeholder interests. Once you've compiled a list of possible policy alternatives, not all of them will be ready for immediate assessment. Patton, Sawicki, and Clark remind us that many alternatives may need changing to be workable. This process is about refinement, selecting the most promising ideas and adjusting them for feasibility, clarity, and alignment with available resources. So in this diagram, we show the progression from our policy issue, a list of policy alternatives, narrowing these alternatives to those that we wish to assess, and finally, to identifying top alternatives for final assessment. This process might involve modifying timelines, adjusting budgets, or merging overlapping approaches. And as one example, you might consider an alternative policy option that proposes universal art access, but we have budget limitations that make that impossible. So the analysts might revise this into a phased implementation, focusing first on high incidence regions or high incidence populations. This stage is essential for producing policy options that are not only desirable, but also implementable. Finally, we arrive at policy design. This is the stage where theory, evidence, and strategy come together. Kraft and Furlong define policy design as the consideration of a variety of possible approaches, instruments, or tools that may be appropriate for a given policy problem. This means combining our understanding of the issue with what governments can realistically do through regulation, incentives, information, or direct service delivery. Once analysts have identified a list of possible policy solutions, the next step is to refine or even re-engineer existing solutions to create new ones. So there are several ways that one can do this. By magnifying, we add components or expand scale. By minifying, we simplify or narrow our scope, perhaps as a pilot. Under substitution, we would switch components or processes, such as replacing clinic-based testing with home-based kits. Under combination, we might blend two or more approaches, like integrating harm reduction with mental health outreach. And then under rearranging, we would change the order or sequence. And as an example, we might offer counseling before testing, or vice versa. These modification strategies encourage creative problem solving while staying grounded in existing frameworks and turning old ideas into more adaptive, context-specific solutions. The second stage of modification strategies focuses on contextual factors that can make an existing policy more effective or feasible. We might adjust where a policy is implemented. Maybe we shift from hospital-based services to community centers. We might change the timing, i.e. the pace or sequence, accelerating rollouts, staggering in phases, or extending the duration of a program. Then under financing, we might modify who pays and how much. And under organization, we would rethink administrative structure, such as centralizing under one agency or decentralizing to local governments. Under the third group of modification techniques, we consider decision-making and operational environments. Under decision sites, we would consider who makes or enforces the decision, whether that be elected officials, technical experts, advisory boards, and this might affect legitimacy and speed. Under influence points, we would consider pressure points like advocacy groups, service providers, or beneficiaries that shape how a policy is received or resisted. And then we have risk management, which considers how policies can include safeguards such as guarantees, insurance mechanisms, or post hoc corrections to reduce risks in implementation. For example, if we have a new HIV prevention program, policymakers might shift that decision site from federal to local health departments for faster adaptation, while adding risk management mechanisms like performance-based funding. These small design choices can dramatically change a policy's success or failure. And then once we have our alternatives identified and refined, the next question becomes, which ones are worth pursuing further? Here, Patents Wiki and Clark provide us a set of screening criteria that can help analysts determine what makes a good alternative. We have stability and reliability. Will it hold up under changing conditions? Flexibility and robustness. For example, can it adapt if circumstances shift? Under compatibility, does it align with existing institutions or values? I think you may start to get the point with these, but the most important consideration is that evaluating alternatives using these dimensions helps us narrow the list of top candidates for final assessment into one or two, maybe three final policy options for a policymaker to consider. Now, before concluding, it's important to recognize some common pitfalls that analysts face throughout this process. One, relying too heavily on past experiences. What worked once might not work again in a new context. Failing to record ideas as they arise. So spontaneous insights may be lost without documentation. You also want to avoid locking in on a problem definition too soon and forming preferences too early. Finally, failing to consider the dismissed alternatives as conditions change makes us vulnerable to political and contextual shifts that make previously infeasible options viable again. These pitfalls remind us that policy analysis is iterative and not linear, and it requires curiosity, flexibility, and humility. So with that, we conclude our session for this week on identifying policy options. In the next section, we will explore key informant interviews and equity assessment.